Anyone born after 2008 in New Zealand will never be able to buy cigarettes or any other tobacco products beginning 2023. A new legislation to this effect, passed by the country's parliament, makes it the first country in the world to implement an annually rising legal smoking age. New Zealand aims to become smoke-free by 2025. The new law is a step towards a smoke-free future, as per the country's health minister. However, critics argue that the new policy will fuel a black market in tobacco products. How will the law banning smoking in New Zealand work? How is the first of its kind legislation being seen by governments of other countries? That and much more on this edition of the Global Debate. Hello and welcome to the program. I'm Teena. Joining us is an illustrious panel of experts who will share their views with us on the historic law banning smoking and tobacco products. Pleased to welcome on this edition of the Global Debate, Professor Janet Hoke, Professor of Public Health, University of Otago, New Zealand. She's also co-director of Aspire 2025, which is a University of Otago research team whose members undertake research supporting the government's smoke-free 2025 goal. Professor Hoke, thank you for your time. Welcome to Sansad TV. Delighted to also have with us on the program Dr. Marita Heffler. She's Associate Professor, Menzies School of Health Research, Australia. She's also Senior Editor, Tobacco Control. Dr. Heffler, thank you very much for joining us. Professor Jeffrey T. Fong, Founder and Chief Principal Investigator, International Tobacco Control Policy Evaluation Project, University of Waterloo, Ontario, Canada. Professor Fong, thank you very much for your time. And Mr. Chris Bostic, Policy Director, Action on Smoking and Health. He joins us from Washington, D.C. Mr. Bostic, thank you very much and welcome to Sansad TV. Professor Hoke, let me begin the program today with you. What we know is that anyone born in New Zealand after 2008 will now not be able to buy cigarettes or tobacco products. But what are the other key features of the law that New Zealand is set to enact in 2023?
Look, thank you. First of all, perhaps I could just clarify that our legislation doesn't ban either smoking or tobacco products. I think what it does instead is to address this anomaly that we have treated tobacco as though it's an ordinary consumer product, when quite clearly it isn't. In fact, it's a product that's going to kill 2/3 of its long-term users. So the legislation that we've introduced in Aotearoa recognises the extraordinary harms that tobacco and smoking impose on tobacco users. And it introduces 3 very logical and 3 evidence-based new measures. And those measures, first of all, and most importantly, are denicotinisation. Now, this is a measure that is going to set a maximum nicotine level in smoked tobacco products. So it's a large reduction on the nicotine content of products at the moment. It's based on evidence that we have from trials, which show that people who get these cigarettes smoke much less, are much more likely to try and quit, and much more likely to succeed in their quit attempts. So that's the first core measure. The second one will greatly reduce the retail availability of tobacco products by reducing the number of outlets able to sell these. So at the moment, we have around 6,000, and that will decrease to around 600. Again, that's based on very strong evidence. We know that young people who live in neighbourhoods where there are a lot of tobacco outlets are much more likely to experiment with smoking. And of course, having many outlets selling tobacco makes it much harder for people who are trying to quit to see that smoke-free journey through successfully. Right. And the last measure is the one that you've already been talking about, and that is the introduction of a smoke-free generation. And as you've explained, that means that young people who are born on or after the 1st of January 2009 will never legally be able to be sold tobacco products. Now, I think this measure is really important because it recognises that young people actually have a right to be protected from harmful products, and that's what this legislation puts in place. So that's a quick overview of the 3 core measures.
Certainly. So important features which have, of course, garnered a response from other parts of the world as well, which have seen similar campaigns. But before I go across to other panelists for their views, Professor, one question on the kind of reactions that it has generated within New Zealand. How is the younger generation looking at this kind of law?
Well, look, I think there's been overwhelming support from clinicians who have to deal with the problems that tobacco causes, knowing that the diseases that they treat are entirely avoidable diseases. There's been extraordinarily strong support from public health researchers and community workers and advocates who've been calling for a very long time now for stronger measures to make sure that we can reach our smoke-free 2025 goal. We also know that young people themselves support the smoke-free generation, and we know that from some in-depth work that we've undertaken with them. We know it from surveys that have been conducted in other countries, and I know you'll be talking to Professor Fong about the very large survey that he leads of people who smoke and who have recently quit, which we also conduct here in Aotearoa, New Zealand, and we see very strong support among people who smoke or who've recently quit for the smoke-free generation policy and also for the denicotinization policy.
Professor Fong, coming to you for your thoughts on the new law that New Zealand has brought about and which, of course, is being talked about a lot in the world as well. The fact that we are well aware smoking is killing at least 8 million people every year, it's a major cause of worry. But no country has ever taken this kind of a bold step further. There have been smaller measures, but they've largely not been as successful. The question to you is, what kind of game changer will this particular legislation be when it comes to ensuring and aiming towards having a smoke-free society?
This is indeed a game changer. The measures that have been proposed in New Zealand have been talked about for a very long time. And New Zealand will be the first country to implement these extraordinary new measures. Just a little bit of context, smoking is probably the #1 preventable cause of death and disease in the world. It kills, as you said, over 8 million people, 7.1 million from smoking, and 1.2 million non-smokers die of secondhand smoke every year. So New Zealand has a really strong combination of these measures that have been talked about. And one of the most important, I think the most important from my perspective, is the lower limits on nicotine in smoke products. That's a truly game changer because as it's often been said, people smoke for the nicotine, but they die from the tar. And so if you take out the addictive component of cigarettes, namely the nicotine, then there will not be the kind of incentive and addictive aspects of cigarettes. So you're going to get from projections and from the clinical trials, you're going to get substantial people quitting. And moreover, for youth, there's not going to be any addictive potential. So no youth or very few youth will become addicted to these deadly products.
Mr. Chris Bostic, the fact that, it's being hailed across the world and a lot of countries are now looking at the New Zealand law as a model law, the fact that at the same time there are also various concerns, and one of them is that the legislation does not take into account the vaping culture, which is, getting prevalent among the youngsters. In fact, in New Zealand itself, the percentage has risen. There is a survey that was conducted a few months ago, and it shows that while smoking percentage has gone down in the country, those adapting and those switching to vaping has gone up. How big a concern is that then in the times to come?
Well, I think it's a concern for sure. And let's be clear that addiction itself is a harm. And so we should be concerned about youth becoming addicted to anything, including nicotine. But as Dr. Fong just mentioned, the deaths from tobacco come from cigarette smoking. And it's, I think, very proper for New Zealand to start there and to reduce the deaths in New Zealand. They can come back and regulate e-cigarettes in other ways. While e-cigarettes are not perfectly safe, they pale in comparison to cigarettes, which are by far the most dangerous consumer product in history.
Marita Heffler, coming to you for your thoughts on the bill. And give us a sense of how the new policy measure in New Zealand is being seen in neighbouring Australia.
I think in Australia there is similar concerns about the expansion of youth vaping, but it's important to note Australia and New Zealand have got very different approaches, but we've got a similar problem. So it is something that we need to be dealing with. But it also, I think one of the concerns about vaping is that it's either a gateway for young people to start smoking, or it undermines quitting attempts by people who do smoke. And the measures that New Zealand are taking will remove that possibility, the fact that the tobacco itself won't be addictive anymore, and that its availability will be so restricted, actually removes some of the concerns that we have about vaping, which doesn't mean that we don't need to address it on its own terms. I think Australia is generally there's a great excitement at seeing how this unfolds in New Zealand. One of the really important aspects of it is that it's going to be carefully evaluated as it unfolds. And that means that lessons can be learned for other countries. The fueling the black market is, of course, always a concern, but it's a measure, it's a concern that is overplayed by the tobacco industry repeatedly about any tobacco control policy. And I think both Australia and New Zealand are very lucky in that as island nations, controlling the illicit trade is a little bit easier for us than it might be for some other countries.
Professor Hoke, what is the kind of noise that the tobacco industry is making in New Zealand? They've, of course, raised these concerns in the past. They're now doing it again. But have they vehemently been opposing it, as we've seen in other parts of the world? Each time there's a measure to either curb tobacco products or ban smoking, there's a lot of noise about how it will fuel black market. Also, the fact that it is going to impact livelihoods of the small businesses, the shop owners. So what is the kind of response that you see coming in New Zealand from this industry?
Well, we've had little direct response from tobacco companies, and I think that that's probably because they've been making so many statements about the way in which they are transforming, the fact that they no longer want to sell smoked tobacco products. So I think having put those claims out, they're in a very difficult position when a country introduces legislation that will bring about and support the very transformation that they claim to be undertaking. So tobacco companies have been quite quiet, but we know that they operate through front groups, even if it may be sometimes difficult to trace the actual funding lines. So what we have seen, as you've noted, are concerns that are being raised about the impact on small retailers. I think it's important to note that it's over 10 years ago that Aotearoa New Zealand first announced that it was seeking to become smoke-free by 2025. So small retailers have had a long time to adjust to the policies that have taken a while to come into place, but that have always been on the discussion table. I think also we need to recognise that tobacco is a very low margin product, and it doesn't drive footfall. So it's actually not a product that contributes to the profitability of these stores. We have examples here of stores that have delisted tobacco products and found that the replacement products that they've introduced have actually made a better contribution to their overall business. So I think although there are concerns, we also have to be critical and thoughtful about the kinds of claims that are being made. You're right that tobacco companies have put out arguments about the black market increasing, but again we have information from studies that we've conducted here that estimate that black market tobacco is only around 5% of the tobacco consumed. As Dr. Heffler said, we're a small island nation, we have an agricultural economy, we have very strong border control to make sure that the products that are produced and sold from Aotearoa don't get troubled by pests or other diseases that are imported. So we're confident that the enhanced border control measures that the Minister has put in place are going to be effective. And as I said, we know from research that we've undertaken here that the tobacco companies routinely overplay the impact that a black market is going to have. And the evidence that we have is that the black market has stayed stable over a long period of time, regardless of the policy measures that have been introduced.
Okay, Mr. Bostic, the fact that, the legislation and the benefits of the new policy perhaps far outweigh the concerns, because we've been hearing them from the tobacco industry every now and then. A similar measure is announced in any part of the world. Do you now see the New Zealand legislation becoming a model law, more and more countries adopting a similar policy measure, because a smoke-free society is not just beneficial for a particular country, but the world at large?
Well, we certainly hope
Mr.
that
Bostic,
other countries...
Professor, that question is for Mr. Bostic.
Sorry.
Oh, thank you. I certainly do think it's going to be a prime example for the rest of the world. And as you say, this is a global issue. There's actually a tobacco treaty, tobacco control treaty out there. And it's already received a lot of attention. And several countries have announced publicly that they are looking at what New Zealand is doing with an eye to following them. And I know that the European Commission has set up a task force to look at the tobacco-free generation concept. So that would be across 27 countries. I know Denmark and Ireland have independently said that they are looking at it. Malaysia earlier this year actually had a bill in Parliament for a tobacco-free generation law, but unfortunately Parliament was dissolved for new elections, so they'll have to start over there. Singapore has said that they're looking at this as well. And of course, in the United States, we already have one city that has implemented a tobacco-free generation that's already in place. Anyone born this century cannot be sold tobacco in Brookline, Massachusetts. But that is a very small city, and having an entire country do it is a much more important example, I think.
Right, that's a very important point. And Professor Fong, the key lies in the implementation. So the fact that it may be easy to implement the policy in smaller countries, but in larger countries, of course, it's going to be very, very difficult. And that's where all of these underlying concerns, the fact of black marketing, the fact that substandard tobacco products may enter the market, which will, again, be detrimental to people's health. So these are larger concerns which will play up as the demography and the size of the countries will change. Because what we've seen earlier also, a small country like Bhutan did ensure a similar measure. They had to go back on their decision during the COVID pandemic. How do you see an effective implementation taking place in order to ensure that such policy measures are successful?
Well, these are extraordinary measures with potentially profound effects. And the strength of a measure needs to be matched by the strength of its surveillance, of its enforcement, to make sure that the measure gets carried out and has the effectiveness without possible undesirable consequences like black market. You mentioned Bhutan. Bhutan had banned tobacco, but there was free transit from the south, from India. And we did a study in Bhutan, one of the few scientific studies of Bhutan under the law. And the government told us that on Thursday, the vendors from Bhutan go down to India. On Friday, they load up their carts, including the illicit tobacco, and they bring it back to Bhutan, and then they sell it in the markets on Saturday. So there were really no controls. New Zealand, because it's an island nation, and because of its very strong measures and regulations put in place with the appropriate safeguards, is a real ideal example of how to do it right. And we are really waiting to see what actually happens when it is implemented. But I think the key really is for strong regulations and measures such as these, there needs to be strong enforcement so that it carries out in the way that it's intended.
Absolutely. Dr. Heffler, another question that comes to mind is, and the fact that we've discussed with Mr. Bostic earlier, that vaping products have not been banned, perhaps no measure or no feature in the bill covers the vape products. And we know that there are studies that prove that vape products are increasingly becoming more and more prevalent and popular among the younger generation. My question is, why not bring the vape products also under similar measures? Because they will also ultimately be detrimental to the health of the youngsters. And maybe 10 years down the line, we will perhaps be discussing the impact, the negative impact of the vape products as well. So why not include them at the initial stage?
I think, as Mr. Bostic said, there is the option to add on to the legislation to better control vaping products, and I think that's something that New Zealand will be looking at. But I think having alternative products available is also quite important for existing smokers. That they have a product that is not safe, but is less harmful than tobacco products are. As other panelists have said, it's by far the most harmful product. Smoked tobacco is by far the most harmful consumer product in history. And I actually would just like to circle back to one of the points you asked in the question you were putting to Professor Fong around substandard products in the illicit market. It's another point that's brought up by the tobacco industry, but it's hard to think of a more substandard product than smoked tobacco itself. There's no product in history that kills 2/3 of its long-term users. So I think New Zealand is taking the right approach by addressing the most harmful products very aggressively, but also thinking about what legislation is needed for vaping products. So there's also potentially a spillover effect as you increasingly denormalize combustible tobacco, smoked tobacco products. There's the potential for that to spill over into attitudes towards vaping products.
Dr. Heffler, is the World Health Organization doing anything to address this concern? So individually, we're seeing efforts by countries. So, for example, New Zealand is now leading the way. There are countries that may adapt similar laws. But collectively, if it's a global problem, do we see the global institution actually doing something about it?
Well, we have the global treaty, the WHO Framework Convention on Tobacco Control, which provides a roadmap and which has been very successful where countries have properly implemented the measures. It's extremely successful. And New Zealand is building on strong implementation of the Framework Convention on Tobacco Control. There is an article in that convention which encourages countries to go further, bearing in mind that that framework convention was negotiated at the turn of the century. Article 2.1 of that framework convention says countries should go as far as they need to control the tobacco epidemic. So we have the groundwork, we have a framework for doing this, and for it to be done in ways that are appropriate to different countries. Just picking up on another point you made earlier about it's easy for New Zealand to do this because it's a small country, but it's going to be more challenging in larger countries. Some countries will do it on a national basis. Other countries like the US and I suspect India will do things from smaller jurisdictions and expand up as those measures become effective.
Absolutely. And also the fact, Professor Fong, that policy measures will also have to be assisted with community participation, with more of awareness programs, by educating. So just by, bringing up these stringent measures won't work. If we are working towards a smoke-free society today, perhaps there are assistive measures and, we have to build that framework accordingly. So in that aspect, what is it that you suggest? And especially with larger countries where the challenges will be immense, how should we approach in enabling a society wherein youngsters will not be addicted to tobacco products?
So I think any kind of tobacco control measure, like any policy of a government, the government needs to communicate the reasons why measures are being taken. In the case of tobacco smoking, it's extraordinary. 2/3 of regular smokers die. So that needs to be communicated first and foremost. Then the government has to indicate or communicate to the society why it is taking these specific measures. And I think New Zealand is has been doing this for a while. And as the legislation moves forward into actual implementation, that will be an extraordinarily important part of making the legislation really work in its implementation. With respect to making sure that kids don't get addicted, and especially some issues regarding gateway, I think the New Zealand measures are really important because they are combined. You've got the very low nicotine, which is not going to have kids be addicted to nicotine through smoking. And with respect to gateway, if there is any gateway between vaping and smoking, the fact that there is very low nicotine in cigarettes is not going to be attractive in a gateway from vaping to smoking. So even if kids are vaping, and some of them will be addicted to vaping in New Zealand, they won't go to they're very unlikely to transit to the very deadly form of nicotine, namely cigarettes.
Professor Hoke, time allows me to take up only one comment, so I'll take the last word from you.
So you'd just like me to comment overall?
Yes. Conclusion.
Yeah, thank you. Obviously, I agree with what my colleagues have said. I think that this is a truly world-leading approach that we have in Aotearoa. Just to pick up on your comment earlier about the need for clear communication, I think what our minister and her ministry have done is to issue a very comprehensive action plan, and part of that action plan recognises the strong importance, first of all, of leadership from our Indigenous Māori community, because that's where much of our end game thinking came from, but also the importance of clear communication with communities. So I think that the points that you've been highlighting as important in large countries are also critically important in smaller countries, and part of the planning that we have underway here in Aotearoa. As Dr. Hefler said, our plan also makes it clear that we're going to evaluate the effect of the different measures that are being introduced. And here I think we'll be able to make a global contribution, because the evidence from Aotearoa might be precisely what other countries need when they're introducing and seeking to gain support for policy measures that are similar.
Absolutely. That's a huge step. That's in fact a bold step, to say the least. And the fact that, more and more countries are talking about it, they're looking at adopting similar measures in the near future. So let's see how we work collectively towards a smoke-free society. But that having been said, I'll have to wind up the program. Thank you once again to all my guests for joining us on the program today and sharing your thoughts, your views with us and our viewers. Absolute pleasure to have all four of you on this edition of the Global Debate. And to you viewers, thank you very much for your time. I'll see you same time next week. Take good care of yourselves and keep watching Sansad TV.